My name is again Alex Pashov. We are from Crystal Touch Clinic, which is based in Rotterdam. And during the last decade, we have been doing quite a lot of work for rehabilitation of patients with long-standing residuals of various kinds of facial palsy. We have been able to help them, and that is what we do. This is what is our specialization, and that's what we dedicate all our time to. And the depressor anguli oris, it's really big muscle which is standing us in the way for the smile. You see, it's wide, it's thick, it's strong. So even with the very moderate recovery, it has a capacity to stand us in the way to smile. That's one of the reasons why when we try to smile, we have dimples here. Because what's called the reciprocal inhibition, also very fancy word, but basically it's when it's disrupted, which means when the agonist muscle contracts, the antagonist must relax. Because otherwise, we'll be doing a lot of effort with no movement. And that's exactly what happens when we are smiling, but the mouth corner is not moving. The innervation of the facial muscles can be restored very well, but if one is pulling up and the other is pulling down, we get no movement. And that's what we are going to work with, and that's what we are doing with our patients. We teach them and learn together with them how to moderate this process and how to get it back to what it should be and what it is actually on the healthy side. Because when we smile with the healthy side, it works pretty well. But when we try to use our affected side, the picture can be quite different. Symmetrical relaxation, that's very important. Because at this, quite often, in most of the cases, the patient with the facial nerve palsy, kind of develops a rejection of the affected side. We consciously or unconsciously pretend that it's not there. We let it be. Let it go its own ways. But we forgot one thing. We have one face for the whole lifetime. And it is our friend literally for life. And we do not leave our friends behind when they are in trouble. We help them, we support them, and we lead them out of trouble to the best of our abilities. We must realize it. We will never have another face. So we better help this one.
Okay, I'm Martin. I've had Bell's palsy for about 4 years now, and I finally came along to this seminar and workshop, and I believe it's the first time that I've actually been in a room with some people who actually knew precisely what they were talking about in terms of facial palsy. Very informative and educational during the morning, and the workshop just reinforced what new skills I've got to learn to actually put my face right. So I'm going away very, very encouraged indeed, and I would recommend to anyone who's got a facial palsy problem to get in touch with Crystal Touch.